30 years ago, in the heart of Kampala, a vision took root. A vision to redefine healthcare in Uganda. Today, that vision stands as a pillar of trust, innovation, and compassion.
Case 30 years this year. We're very proud of it. Started a long way back, 30 years ago, as a clinic. Up till now, many people call it case clinic, and don't have issue with that. Just shows you how deep the brand has grown into the country. The inspiration of case, the beginning was that wanted to set up a health unit where all services are under one roof. And I think we've largely achieved that. Today at Case, 24/7, you can find any specialist, you can find any services, even on Christmas at midnight. So that was the inspiration. It started as a small unit, Bombo Road, but being the first 24/7 private clinic, it actually got up quite easy. What inspires any business is a vision. And I felt that we're slowly catching up, moving along the vision. Ups and downs were there, but we're slowly getting there. The numbers grew, Case became a household name, and everywhere you go, they'll be talking about Case in the professional arenas, many households, and that inspired us to keep going.
From its modest beginning to becoming a leader in private healthcare, Case Hospital's story is one of resilience, adaptation, and relentless pursuit of excellence.
Of course, there has been a lot of impact as far as the healthcare space is concerned. But for the time I've been here, I must say that the first impact was during the COVID pandemic. At first, all areas were handled by government hospitals, but Case was the first one to be allowed to handle COVID. Among the signature departments, I'm proud of the laboratory. And secondly, the nurses are mothers in a medical field. They are the people who take care of the patients. So, in whatever we do, the nurses are our core pillars. So, I'm also proud of that department. It has made wonders. If a mother gives birth, the nurses are there. If a patient is from theater by the doctor, the nurse is there to manage. So, it's one of those departments that we appreciate the efforts being done, and they have lived to represent our core values and mission. And of course, key specialties and key areas like ICU and NICU. Those are some of the areas that we present to the public and to the patients that have trusted us to live by the values and the mission we hold.
We run a facility that basically sees patients from different walks of life, and on any average time, probably get about 300 walk-ins coming to the hospital. And usually when people come, they start right from our reception area, and then they go on to see the different doctors. We are very big on making sure that we provide the kind of service that does not only tailor to everyone's needs, but is also given in a very timely manner. So in the background, we're always watching out for the time that a client spends at our facility. And we also go back and review reports almost on a daily on what exactly is happening, the kind of clients that we receive, the kind of conditions that we were able to see, but also the needs for the different kind of care plans that patients are receiving. And one of the most interesting things is that it's a one-stop center for me. It's still one of those facilities where you can come and get all the services that you require to get as far as hospital care and management is concerned.
So Case Med Insurance has been pivotal in expanding healthcare to both corporates, families, and individuals, as I had earlier said. And it has made it affordable and predictable for families, businesses to pay out of pocket at affordable prices. We started with a Case Hospital But then we realized there were people who didn't want to pay out of pocket every time they came to the hospital, and they would leave us with money to offset their bills. So that's how Case Med Insurance was born.
Case has been at the forefront of shaping the medical industry in Uganda, to the extent that now people out there know that for you to get quality healthcare, you need to go to a private institution. This is not because it was by chance, but as Case Hospital, we've actually pioneered very many modern medical interventions, and many of them were first actually done from Case Hospital. Case in point is dialysis that we talked about. Case Hospital was the first private hospital to start dialysis. So that is important. There is something Dr. Sebale jokes about a lot. There is a complex surgical procedure called Whipple's procedure. We do it for people that have advanced cancer of the pancreas, but also complications within the liver, pancreas within that region. So he keeps saying he was the first surgeon, along with his late colleague in Mulago, to do this procedure. But after that, we've had so many of them being done at Case Hospital. So many of them being done, of course, by him at Case Hospital. So there are many things that have been done in this part of the region regarding new interventions in medicine, when most of them actually have begun from here.
From pioneering medical technology to nurturing community trust, Case has shaped healthcare standards in Uganda, delivering not just treatment, but hope.
I'm proud of the fact that, for instance, people who never have lived with dead kidneys can live now, and many other units have come up. But I'll tell you the truth. When I set up that unit, the manufacturers of the machine were very negative, saying that you cannot have this set up like Kampala, because then you had a lot of dust in the country, the city. But I visited a lot of units out there, and I could see units in homes. I said, okay, if somebody can handle it in a home, why can't I do it in a hospital, in a clinic? So that's one inspiration. Today, many other people are confident to do the same. I'm confident that even when a big epidemic like COVID came in, we were able to stand up to treat COVID patients. Very few units in the country were confident to do that. If Ugandans can believe that we can do it, then I think we can own our country.
We're spreading. We are putting up satellite hospitals or clinics, if you like, in various points in the outskirts, so that people don't have to drive into Kampala. Somebody wants to be attended to in the evening, at night. You want them to just walk out of their house, and 5 minutes they have service. So we're spreading. We already have about 2 or 3 satellite clinics, and the idea is to have more and more of them, so that we reach the people out there where they are. Now, when we do that, it gives us the opportunity. We have very good doctors here. So we want this to be a specialist hospital. We want it to be a specialist hospital. We want it to be a teaching hospital. So that the center now focuses on more specialist services, rather than treating your malaria and your headache. That can be handled by the clinics.
I've literally seen Case go through significant growth. I came to a Case hospital, for example, that did not have a neonatal unit. And as I speak, here we have a 7-bed neonatal unit. Not only that, we have so many success stories from the neonatal unit that we have today. And you can imagine, in this facility, we are able to take care of preterm babies, babies that are born before time, up to about 600 grams. And these babies go home. So there's quite a bit that has changed in this facility. And progressively, a lot of these changes have been because of the fact that as far as equipment is concerned, the hospital has been able to significantly equip, but also ensure that the doctors have the kind of gadgets that they need in order to do what they do. I love to tell my different team members that any doctor is as good as the gadgets that they have. Small things like a stethoscope is very important in order for you to be able to make a diagnosis, but also beyond that, beyond the stethoscope, are the different other equipments that you might need. So when doctors are equipped, it makes life extremely easy because you can be able to access all the care plans and eventually take care of the patients as you need to.
Looking at the nurses and midwives that we have today, they really reflect what the case definition of a nurse would look at, and we have really tailored them to fit into the case values: courtesy, accountability, service, and excellence. Now, these can be broken down and broadened, and when you look at how our nurses are, they are very empathetic, they are very loving to our patients, they really give in their best when it comes to looking after our clients. And I will tell you, when you come to Case Hospital, you will really appreciate the touch our nurses and midwives give to our clients. It's really amazing.
30 years ago, we began this journey together. Today, we celebrate not just our past, but the promise of what's ahead. To our staff, our patients, and our partners, thank you for being part of the Case story.
It's beautiful that we are celebrating 30 years of Case Hospital. It's been an interesting journey. We have learned a lot from our past, and I must say that taking on the international accreditations will not only make us bigger, but much, much better.
We thank the public for working with us on this journey. Your trust has been our motivation as we celebrate 30 years of service. So we reaffirm our promise to protect your health, reduce your medical burden, but also to be a partner you can rely on.
Staff members of Case Hospital, doctors, our patients, we are so grateful for the journey that we've moved together. 30 years is not something simple. You realize that we began as a small unit, and we are currently at the pinnacle of medicine in Uganda, influencing medical decisions, but also bringing on board modern methods of medicine.
We want to give thanks to all the partners that we have worked with and call them to celebrate with us 30 years, because some we have dealt with them directly or indirectly.
I'd like to thank the CEO for the vision he had and the vision he still has to carry it forward. He could have sold, but he stayed the course. It's something he still wants to do. He still feels he hasn't done enough. So I'd just like to thank him for that. I'd like to thank our board. They put in a lot of time, even outside board meetings. So we'd like to thank the staff in a very special way. We thank them for being with us as we celebrate 30 years. Hopefully some of them will be around when we celebrate the next 30 years.